Occasionally we get patients in our office who are complaining of neck pain, that they're noticing that that pain is traveling down the shoulder all the way into the arm, and it can even come down into the hands and fingers. They may notice pain going down that arm, they may notice numbness, they may notice tingling, and if this is the case, what they're probably dealing with is a bulging or herniated disc in the neck. So if you've got this going on, let's talk about it. Our cervical spine is made up of 7 bones that all sit one on top of the other. And those 7 bones are meant to move in 6 different directions. They bend forward, they bend back, they lean side to side, and they turn both directions. Now, in between those joints, we have these little cushions called discs. These discs are like a jelly donut. They've got a hard outer shell and they've got a fluid in the middle of them. And one of the things that the disc does is it acts as a shock absorber within the spine. Now, if that fluid is in the middle of the disc where it needs to be, it often doesn't cause any symptoms. However, as we get older and we've had injuries in the past, sometimes that disc can start to bulge to one side or the other. So people with a bulging disc, especially in the neck, some of the symptoms that they will notice is pain on one side that may radiate down the arm. So if the pain goes down the arm, if they're noticing numbness and tingling, kind of electric pain, kind of a burning pain, that's usually an indication that we have some nerve irritation and some pinching of the nerves in the spine. Now, just because we have pain that goes down the arm with numbness and tingling doesn't necessarily mean that it's not a chiropractic issue. Now, obviously, if there are some things that we have to rule out to make sure that it is an issue that we can treat with chiropractic care, but if it is an issue that's coming from the cervical spine or from the discs, we have great results in our office with this issue, and people with bulging discs in the neck can see great relief without any form of drugs or surgery with the care that we provide in our office. Now, depending on how bad that disc issue is, it depends on how we approach it right out of the gate. Now, if it's a really bad issue and our patients are in a lot of pain, they may not tolerate chiropractic adjustments very well. So we need to know when to adjust, and we also need to know when not to adjust. But one form of treatment that we offer in our office that we see great results with is called cervical decompression. Now, decompression therapy is just like it sounds. We put a little bit of a harness under the chin, and we use a machine to stretch and pull the joints and relieve pressure on that bulging disc. Now, as we pull those joints of the neck apart, one thing that happens is we create a suction, a negative pressure within the disc. And if that disc is bulging to one side, as we pull it apart, we can see that bulge start to work its way back into the center of the disc where it's supposed to be, and we relieve that pressure on that nerve, and we start to see what we're looking for, which is called centralization of the pain, which means if that pain is in your hand and fingers, and then the next day it's in your elbow, and then the next day it's in your shoulder, and then the next day it's coming back up, if we see it coming back towards the midline, that means we're making progress. So sometimes we can adjust these, sometimes we can't. It all depends on how the patient presents to the office. But when a patient with a bulging disc comes in, sometimes we do adjustments if they can tolerate it. Sometimes we will do decompression therapy. And then again, just like anything else, we often develop these issues as a result of what we do all day, every day. So most of our patients, in addition to the manual care that we provide, need some form of a rehabilitative home exercise plan to address the muscle imbalances that are underlying some of these issues in there. So when people come in and they've got a bulging disc or a herniated disc, most of the time, if we approach it correctly, chiropractic care is a very safe and effective treatment to this issue. And we've actually helped some of our patients avoid surgery with the care that we've done in our office. So a bulging disc, a herniated disc in the neck is not something that people need to be concerned about when going to a chiropractor, but a good competent chiropractor will know what to do and what not to do when that patient comes into the office. If you or anyone you know is noticing that neck pain that radiates down, it may kind of go back behind the shoulder blade, you may notice numbness, tingling down into the hands and fingers, it could be coming from a bulging disc in the neck, and it could be something that we could help you out with to help you avoid taking any kind of medication or needing any kind of surgery. So I'm Dr. Mike Stanley with Stanley Chiropractic. We're located in East Wichita. So if you or anyone that you know is struggling with this, we'd be happy to help them out. So give us a holler. We can set up an appointment. We can get you taken care of. Thank you.